contain the virus's spread through the community and avoid a full lockdown. Contact tracing apps have been developed, but remain unnecessary so far. It continues to stay vigilant to misinformation. I spoke to Taiwan's digital minister, Audrey Tang, a short while ago about the government's handling of the virus and its attitude towards data and privacy. I started by asking how Taiwan collected the relevant data and information to inform its coronavirus response.
In Taiwan, we make sure that we publish data as soon as it's collected if it's not related to private information. So for example, in the very beginning, last December, when Dr. Li Wenliang, the PRC whistleblower, shared their 7 new SARS cases in Wuhan, although he got questions and harmonized in the PRC in the beginning, the Taiwanese equivalent of Reddit, the PTT, has someone reposting his warning, and so it got escalated within a day. So the very next day, the first day of January, we started health inspection from flights from Wuhan to Taiwan. And so this is built upon Taiwan's very open civil society, that the government trusts the citizens enough, so when they talk about new SARS cases, instead of getting harmonized, they will get escalated into the early advanced deployment of our yearly drills that we have been doing since SARS. So it immediately kicked in. And so the CECC, the command center, was set even before we have the first locally confirmed case. And everybody can call 1922 to get a response from the CECC on the most commonly asked questions. And they can also make suggestions. For example, back in April, there was a young boy who said, okay, you're rationing mask, but all I get is pink medical mask, and I don't want to go to school because my classmates may laugh at me for wearing pink. And the very next day, everybody, the commander and all the medical officers, wore pink medical mask, showing solidarity and also amplifying the ideas of gender mainstreaming. And so our 3 pillars of fast, fair, fun make sure not only people get their ideas into the CECC decision-making within literally a day, but also for each and every pharmacy, you can see that how many medical masks for adults and how many for children are there in stock. And if you go there and you actually make a purchase using your national health insurance card, which covers more than 99.99% of not only citizens but also residents, you can actually see the stock level decrease in real time after a couple of minutes. So we make sure that everybody queuing in the pharmacies can hold the pharmacist and the entire system indeed accountable without having to blindly trust the government or any of the corporations.
So the data is being used in a public information way so that people know where there are masks that can be bought, and so they don't have to queue or go from place to place, which is obviously a great time saver, and also that saves people from having to wait in a line where they might have a risk of being exposed to the virus, which is what we've seen in other places. But, you know, at any one point, there were people at some point in quarantine in Taiwan, and there is some information being collected about those people. For example, there was a use of triangulation, base tower triangulation, to make sure that they don't go away from their home or the place that they're being quarantined in, which I think Taiwan is calling its geofencing.
Digital fence, yes.
Yes. What happens to that data, and how do citizens feel about having that collected?
Yeah, first of all, it's not new data collection, because all the base stations of all the telecoms that you subscribe to already have your signal strength data anyway. So that's already collected in order to provide their roaming service, right? So because of that, the 3 most closest base stations, if you're measuring by signal strength, draw 3 circles, it automatically know within around 50 meters radius where your phone is. So we already use this data, for example, for earthquake landslide warnings, for typhoon flood warnings, for things like that. So people are used to the idea of receiving SMS when they need, for example, a evacuation because of typhoon or earthquake. And so we repurpose an existing system without collecting new data, because there's a saying, anything that's around when I'm born is human nature. Anything that's discovered after I'm born is called technology. Right. So paraphrasing a little bit, anything we deploy before the pandemic is social norm, and anything we invent after the pandemic will be highly contested and controversial. So we repurpose the existing data collection. And of course, after the 14 days of quarantine, we will have no constitutional basis to keep, sounding the alarm when your phone breaks out of a digital fence. And so all the relevant data is no longer kept then. And if you don't like that idea of digital fence, you can always choose a physical quarantine hotel, in which case because you are physically barred from leaving for 14 days.
Do you think that's enough to assuage concerns about the balance, the very fine balance between public health and privacy?
Yeah, definitely. What we're looking at is we're challenging the entire civil society to discover better ways that are more privacy enhancing in order to make the contact tracing work. So for example, in cohack.tw, which is a collaboration coronavirus hackathon born out of the Taiwan-US joint statement on consultation, one of the winners, the Logboard team, specifically developed an app that person can install in order to track their own whereabouts and temperature and symptoms and so on, but it doesn't transmit it anywhere. It doesn't use Bluetooth or 4G or 5G or any transmission technology. It works entirely in airplane mode. And once the contact tracer, the medical officer finds the person, with one click, they can generate this one-time web page that contact tracers can use, but only provides the absolutely minimum information required for contact tracing to work, instead of in a traditional interview where you probably divulge private details of your friends and families. So it's built as a way to protect the privacy of the person, also their friends and families, because memories are not reliable and may divulge more than the medical officer actually requires. And so when it's working, strictly speaking, for the person's individual and also their family and community's benefit, it has a much more rate of being adopted. And if it works on a top-down way, that is for the surveillance state or surveillance capitalism, of course, people will be wary of the idea.
So we're talking about data being the new currency. The currency usually equals money, and money equals power, right? So how is Taiwan helping to protect and secure its data, whether it's data on its citizens or other data that it may have, at the government level or even at the lower levels? What are the steps Taiwan are taking towards this?
Yeah, so basically our idea is that social sector need to mint the data. The data's ownership, controllership need to be firmly rested on the civil society using open source code, open algorithms, making sure that people can collaborate on this data collaborative entirely managed by open community. So including the air quality measurement, that is thousands of air boxes just by primary school teachers. Anyone who want to buy one of those, they can pay for less than $100 because everybody have brought them as human right. 4G unlimited data is less than $16 a month, and everybody can contribute to the common kind of sensing of the data around weather, around air quality, around water quality, and things like that. And when the data sources are curated by people, we talk about data competence, that is to say, the ability of becoming a producer of data rather than literacy, which is being a consumer of data. And once everybody is a producer, they will then hold the checks and balances in a collaborative fashion rather than relying on a single point of truth, whether it's in the capitalist regime or whether it's in the state.
So what you have right now is very much based on trust, the trust that's been built up in the government to do the quote unquote right thing with the data. But what if that changes, or in a situation where there isn't that kind of trust? How can that be built up in order to make the most use of this open data that you are talking about?
Well, every time the CECC answers a journalist question directly, that builds trustworthiness. So instead of trust, which is kind of abstract, I would like to talk about trustworthiness, which could be earned, just like currency, right? So whenever we disclose the algorithm upon which this kind of distribution is done, the people are welcome to do their own analysis based on the open data. For example, for the mask distribution data, this is not just about a ledger, but individuals who are interested in making dashboards can analyze that whether what we're saying is true, that we're really ramping up the production of the mask from 2 million a day to 20 million a day, whether there's an oversupply of adult mask in a particular district or an undersupply of children's mask in the same district. And so making their own analysis informs the decisions. And all the pharmacists are also data producers, so they co-create this distribution system. If they have a vote in it, if they have a say in it, then of course they will feel that this is our data, that we're curating this data. And if they have no say in it, even though we're completely transparent, if they have no decision-making power or agenda-setting power, then of course they will feel alienated from the data production. So I think trustworthiness, which could be earned by co-creation capabilities, that is the most important.
What about things like cyber attacks and cybersecurity? How does Taiwan protect its information and data from that. That is an ongoing problem, whether it's at a state level or at a lower level. We've had Twitter accounts being hacked recently, also accusations that various places are trying to hack into virus research as well.
Yeah. A few things, right? One of the most important ideas in cybersecurity is the idea of advanced threat hunting and purple teaming, meaning that you hire white hat hackers or white hat hackers volunteer to work for you, work with you to disclose those vulnerabilities and give you a chance to think in a way how attackers would think in a kind of a real drill without the malicious black hat hackers actually taking their hands on it. And so for the major public digital services, for example, the self-driving cars on the 5G Shalom proving ground, or our own digital exchange system called Sandstorm.io. In each of those cases, for 6 months or so, we invite the white hat hackers in a kind of bug bounty so that they can try hack into the system before we actually deploy the system to a wider population. And if they discover those CVEs, which are like badges of honor, we make sure that we pay them well, treat them well, so that in Taiwan, if you're a white hat hacker, you're actually having a very lucrative career. You don't have to do exercises because there's real cases literally every hour, and you get to meet with the president and the minister all the time, so that you get treated very well like national hero, so you won't fall to the dark side, which always has more cookies.
Every country, every state has issues with misinformation. So what are the main channels for misinformation in Taiwan, and how is that?
Yeah, so of course in Taiwan we have end-to-end encrypted channels such as WhatsApp and the Line. Of course, there's also Twitter, Facebook, and things like that. And for misinformation, which are just people feeling confused or angry or fearful about, for example, panic buying, a shortage of tissue paper, and so on, people naturally will click share just to alleviate their fear or outrage a little bit. So clicking share is kind of therapeutic for people, is a kind of self-medication. But this also makes this misinformation have a high R value, maybe R value of 3. That's to say, on average, every person will share to 3 other people that they know. And because it's end-to-end encrypted, of course, we're not doing any takedowns. What we're doing instead is to make sure that we provide vaccination for the infodemic that travels faster than the conspiracy theories. And this has a way we call it humor over rumor. And the humor over rumor makes sure that we respond with each and every case of misinformation. For example, there was a misinformation that says, oh, we're going to run out of tissue paper soon because it's the same material as medical mask. So the premier, which you saw a couple of slides ago, this is our premier, Su Zhenchang, just showed this meme of him wiggling his butt a little bit, showing in very large font. Each of us only have 1 pair of buttocks. And this makes sure that people think of the tissue paper in a very funny frame, but this table says the tissue paper are pulps made from the South American materials, but the medical masks are PP made out of domestic materials. So anyone who look at this and laughed about it is literally unable to feel outrage, because joy and outrage are mutually exclusive feelings in the brain. And so when they laugh about it and share it, this maybe has an R value of 5. And so very quickly, this vaccination reaches more people than the conspiracy theory. And then we discover the person who spread this conspiracy theory in the first place was a tissue paper reseller.
Taiwan is very big on using Facebook, for example. I saw a statistic somewhere that most, in fact, almost all internet users in Taiwan are signed up to Facebook. That's a lot of power for one company to have, and a lot of data which is being collected on them as well. Would Taiwan consider something like regulation on a company like Facebook, or do you think there would be more oversight of it?
Yeah, of course, there's a Taiwanese professor on the Facebook oversight board, but we believe in the norm co-creation. That is to say, for example, during our presidential election, we, during the election season, work with the Control Yuan or the Jiancha Yuan, which is a separate branch of the government that publish the raw data of each individual campaign donation and expense. And that is the norm in Taiwan. And so we talked to Facebook saying, from the mayoral election, which the Control Yuan also publish the same account, we see that a lot of advertisement budget is not actually published as either campaign donation or campaign expense. It's like a black box that just disappear into Facebook. And so we say, you either adopt our Control Yuan norms, which is publishing those targeting in the ads library, including who they are targeting, how much money they paid. It has to be from a domestic source, just like campaign finance. Or you can refrain from running political advertisement during our elections, your choice. And there's no law, but they may face social sanction if they do not conform to the societal norm. So they choose to publish in real time those precision targeted advertisements so nobody would try the dark pattern. And then Google, I think, and Twitter and so on simply refuse to run political advertisements during our presidential election.
Right. So the way that Taiwan is dealing with it is either to work with the platform to force openness by publishing information or opting out completely of being a platform for what is considered to be information. Is that right?
That's right. And we always have these norms prototyped by the social sector, like the PTT, which is almost entirely managed by National Taiwan University staff and students. And so because they're not working for advertisers or any other stakeholders, they are very willing to try out new ways in making sure that this co-governance model works.
So there are apps like TikTok and also platforms like WeChat, which have obviously been in the headlines recently, especially because the US is reviewing the national security risks around them. Now, what are your thoughts about that and the use of those in Taiwan?
Yeah, we're also clearly monitoring the same kind of apps and also sharing the intelligence with other liberal democratic countries. But in Taiwan, I think our core infrastructure 6 years ago during the Occupy, the Sunflower Movement, people on the street already deliberated and have a consensus saying that in the core infrastructure around 4G, which was at the time still being constructed, we need to reject all the PRC-made components because there's no, strictly speaking, privately held companies in the PRC. When situation gets intense, the state can just swap any leadership in any of the so-called private companies to become de facto state-owned. And that was the consensus on the street, and it was also adopted by the National Security Council and the National Communication Commission. And so the debate that the entire world is having right now around 5G, we had that 5 or 6 years ago and already reached a clear consensus. So even at the perimeters, there's kind of individuals using apps, as you said. At the core, we held these core networks in a very much isolated from PRC influence way.
So how would you do that though around an app like TikTok? It's fairly popular, being used quite widely. How do you sort of enforce that?
Well, for the critical infrastructures for our soldiers and also for our public servants, there's clear guidelines around which apps that they can install on their phones. And in fact, the popular social media and also some video conferencing and things like that. For example, this very computer that I'm having this video conference with you right now is not my work computer. It never connects to the intranet, to the internal network of our executive and our cabinet connection. This is purely something that I use for video conferencing and social media stuff. And so this is a kind of physical isolation of the open to the public part of my work, as well as the kind of intranet work part of my work. And there's cybersecurity offices in each and every agency and the critical infrastructure, including the science parks and so on, to make sure this kind of isolation is firmly in place. So even if this outward facing device gets compromised, it will not leak into the defense in depth that is the intranet.
So my understanding is you're a big pioneer and a big driver for digital democracy and the use of public data, from what you've been saying, for the good of the country, right? How do you see that?
For the world, yes.
How do you see that unfolding going forwards?
Yeah, I think the pandemic is a rare chance that basically have a worldwide solidarity about a common situation. Before, when we work on, for example, climate science, I shared about air box before, but climate science is held at different priorities, depending, I guess, on how much you're impacted by climate change. But for the pandemic, every epicenter is either 2 months before or 2 months behind of every epicenter. So everybody have the same sense of urgency. So I think using data for the common good is truly global now. And our contributions, for example, out of the CoHack hackathon, even though because we're not in the community spread stage, most of the innovations we actually have no use in Taiwan. We're very much working with other liberal democracies to make sure that our prototypes can contribute to their community transmission management while enhancing democracy and privacy at the same time.
And what about any lessons learned or information that you've gained, insight that you've gained in terms of how Taiwan has handled the coronavirus and its collection and usage of data?
Yeah, well, first of all, trust the citizens. The citizens, when they understand epidemiology, can contribute very meaningful, not only data, but also the application around data, as I shared, around dashboards, around early warnings and things like that. And so instead of relying only on the state or on big corporations, rely on a well-informed citizenry that has been inoculated by previous exposure to SARS.
Are there any other points you'd like to make about data, the importance of data, and the currency that it is in this modern age? I mean, it's such a valuable asset. Everyone is collecting it. Everyone has put a value to it. Whether you're talking about, creating a virus vaccine or monitoring toilet paper levels or mask levels.
Yeah, definitely. And the value is that of dignity. Instead of thinking of data as something like barrels of oil, which is the farthest away from data as I can imagine, except the word extraction maybe works on both. But other than that, they have nothing in common. I encourage the viewers and readers to think of data as labor. So we're at a stage where, like before the invention of labor cooperatives and labor unions, we're still at an early age where we think of labor like the early capitalists, like a mere aggregation of labor. But we will soon find out in the big data terminology, the veracity, that is to say the quality of the intentionality put into curating the data is much more important than the volume and the velocity. And so if people intentionally curate data and form a data collective, that is actually the best way to make sure that the decision that we made out of those data analysis can benefit all. And if people just treat things as mere aggregation, then bias and other problems that out of the data aggregation, basically using data in a way that is beyond its original collected purpose, can actually lead to more imbalances and biases that are very hard to detect. And in fact, in that case, you can treat as mere aggregation like aggregating CO2.
That was Taiwan's Digital Minister, Audrey Tang. Now let's check back on those poll results, and overwhelmingly, the vote was for A, which is yes, we will reach a new status quo pandemic. So we're going to have to look at how that may be panned out for the future. Now, we've talked about the situation in Taiwan, now to Hong Kong, where we've got Bloomberg's quick take reporter, Nicole C. She's recorded her experience using Hong Kong's quarantine technology.
You could probably slip it off. So this is the bracelet that I got from the airport. This bracelet is basically the Hong Kong government's way of making sure that people who cross its borders adhere to the mandatory 14-day quarantine. I left from the Philippines. I get to the Hong Kong airport.
This is for me?
There are people asking you to fill out these pieces of paper.
Thank you so much.
With all your information, your address, ways to contact you. The Hong Kong government is supposed to send you an SMS. From that, you're supposed to download an app. You have to register this bracelet on the app. It's been a couple of days now. I haven't gotten an SMS from the government yet. So I tried to call the hotline.
It says call forwarded. Now it's busy.
I shower with it, I wash the dishes, and I'm constantly washing my hands. So technically, I could slip this off, but I won't. It's staying on there. Even though no one's really paying attention, I'm definitely staying put. I just paid $500 for groceries, so I get free shipping. I didn't need $500 worth of groceries, so I just bought a lot of wine. So I guess it really comes down to the people. It's more of self-isolation than you taking the effort, because it's not just for them, it's for everybody else who lives here.
Well, the wristband design has changed since then, but the functions are still the same. And the person who knows all about it is Arthur Chan. He's the CEO and director of SagaDigits. Now, this is the startup behind the technology of Stay Home Safe. Arthur, thank you for joining us today. Now, just want to ask you, tell us a little bit about how this app and the wristband work together and how the data and the technology is collected.
First off, thanks for having me. The technology actually do two things. The wristband do the geofencing to make sure the home quarantine citizens stay nearby their cell phone, and the cell phone itself capture the changes of signals of the user's home, so that we make sure the user will stay at home during the quarantine period.
Right, and exactly how do you pick up the signals for that? What kind of data is generated, or what kind of systems are used to locate or to geofence the person in their home or the quarantine place?
Okay, first of all, during the operation, the government will help the citizen or travelers to wear the wristband at the airport and register. And the citizen or the traveler only have to click a web button when they arrive the home quarantine location. What the app do is to capture all the signals from the cell phone, including the Wi-Fi, BLE, geomagnetic field, and GPS. We capture the signal pattern of the home quarantine location. So during the period, if the user leaves the home quarantine location, the signal change. If the change is obvious, then the backend will capture the changes. And if the wristband is not nearby the cell phone, there will be a BLE signal, Bluetooth signal submit to the cloud together.
So how accurate is it? Within how many meters can you detect if someone has left that perimeter?
Yeah. So first of all, we highlight the technology is capturing the absolute whereabouts. So we detect the signal change. So it is not the same KPI as the absolute meters, but as you can imagine, if your Wi-Fi and your neighborhood Wi-Fi and your building's Wi-Fi change, it will be a big change. So we have a score measuring that. If the home quarantine user has a very low score for a period, then the government will do a follow-up to see what happened there.
And so you're saying that the app is not tracking where you go, right? It's just creating a perimeter fence so that it will detect your movements beyond that. Is any data actually being collected from the app?
From day one in February, our company decided to do that. How can we do home quarantine without knowing the absolute whereabouts? So all the data does not include the identity or the position of the users in the cloud, so that we capture the signal changes and the score to the cloud. It is a score, and the signal pattern change will be stored.
In designing the app, did you consider what kind of tracking would be palatable or acceptable to the citizens of Hong Kong? Was that something that was held in your mind when you were thinking about it?
Actually, it's our main question when we design the app. We have been doing positioning for years, and we know different technology. Actually, there can be accurate and absolute position track like GPS, but GPS doesn't work in some indoor venues, first of all, and the Hong Kong situation, the citizens worry about privacy much since last year, so that we design the technology without knowing the identity and the position, and the changes of signals should be the best way to know whether a user is staying at home. So we picked this technology.
So was that something that you came to yourselves, or was that something you worked with the government on?
Actually, before the government approached us, we already developed the app, and some media has some articles on our technology, so that's the government approach us. So we do it on our own, and with the university support, Hong Kong University of Science and Technology supporting us, and our investors supporting us to do something for the Hong Kong society. Then we developed this app based on our SDK, the software development kit. So it is the background of the technology.
So this information is held for about 3 months, I understand, and then apparently it's deleted. But during that time, this information can it be used to help the government handle the situation? For example, could the data be taken, extracted, and then used to, for example, look at clusters or where there are a prevalence of cases, as has happened recently, where we've seen a surge in the cases in Hong Kong?
We are only a startup and a technology company. Whether the government will use the data depends on their decision. But from our point of view, the changes of location, whether more people violate the home quarantine policy, can be captured and analyzed from the backend without knowing the identity. And there may be a correlation with the changes and movement and the situation. And if the government can use that data, I think they can analyze the trend of the outbreak of the situation.
How do you keep the data secure, though? It's kept on a government server. So, what measures are taken by you to make sure that this isn't the kind of information, because it is personal information, that can eventually be tracked, although you're saying that the information isn't personalized. But of course, eventually you can add 2 and 2 together in order to, for example, track down somebody who has gone through those perimeters. So there must be a way to put the information together, and that information can be extremely valuable and also very personal. How do you guarantee that safety?
There's 3 tiers of design. So first of all, the data model itself, we decide like what we mentioned. Even we cannot reverse engineer the identity or position. Of course, if the government asks for the other parties' help, other department like Department of Health, they can reverse the identity, but it is a lot of operation behind the scenes. First. Second, our system supporting the casino, hospital, and right now the government. So we went through a lot of security scan. We passed the scan report before it released. And third, the database is inside the government cluster. We are not using the public cloud, so that it blocks the outsiders from accessing the database at all.
Right.
It is how to go to the data.
In developing the technology, though, where did you see the vulnerabilities? How did you overcome those issues?
It's like all the other programming or the app design. There's 2 challenges. From programming, we spend most time not writing the code, but designing the solution. So there's a dilemma. How can I know your position without knowing your absolute whereabouts? So we start from that dilemma and figure out what solution we can pick. That's the most challenging part. And the other is UX, user experience. From our point of view, as an app development company, security or privacy actually is the user experience of that city. Like in China, they accept the contact tracing, and Korea accept contact tracing, and Singapore accept it. But it's not accepted in Hong Kong. So that is the UX that we cannot touch. How can we design an app that's accepted by Hong Kong citizens? And it is our first large-scale project for the government. And so we have designed a lot of scenarios before we release this app.
Last question, your app has helped the quarantine situation here in Hong Kong. and we've seen a surge in cases recently. So it looks like maybe that's not enough now, and there may have to be other solutions to containing the coronavirus spread in Hong Kong. Can big data help in that?
For us, we got data as that is the missing pieces for most of the management system right now, namely the offline data. This home quarantine app is just an example. So how can we use the offline data and protect the privacy to protect the outbreak? It is a big topic that we think that is the next step. All the governments should consider. For example, even for a startup, we can develop our own app to remind the user what they have visited. And if that location, we do some geofencing, has some potential risk, we can alert the user by their own opt-in.
Thank you, Arthur. Thank you for sharing your insights behind the development of your app, Stay Home Safe, which has actually worked pretty well in Hong Kong so far in terms of the quarantine environment that we've been in here since, well, basically since the beginning of the year. So that's Arthur Chan, CEO and Director of SagaDigits. Now, before we move on to our panel discussion, I would like to get your thoughts on contact tracing. As Arthur mentioned, we don't use that here in Hong Kong. We don't use it also in Taiwan, but it is something that is used in other places, for example, Australia, South Korea, for example, and India. And they've seen varying success in those places. So I'm inviting you to take part in our second poll. Would you willingly download and run a contact tracing app to help authorities track and trace? Answer A, yes, I'll do what I can to help. B, yes, only if my privacy concerns are addressed. And C, no, not under any circumstances. You should see the question popping up towards the right side of your screen, and it will just take a moment to answer that question. And we'll come back to that a little bit later. Now it's time for our panel discussion. It's doomsday if you want digital. With the pandemic accelerating digital change, how are companies and individuals adapting? How are they embracing the change as a turning point for the future? I'd like to introduce our guests today. Emma Gray, Group Executive, Data and Automation for ANZ. Sunita Maheshwari, co-founder of Teleradiology Solutions. And Jamie Tarabay, our very own cybersecurity reporter here at Bloomberg. Thank you very much for joining us today, everyone. I'd just like to, of course, get some of your insights on how the coronavirus situation has changed your businesses and how businesses have been preparing and adapting for that situation. Perhaps I can start with Sunita. Sunita, you've got two businesses. One is a teleradiology business and the other is a diagnostics business, which is a global business. Can you tell us a little bit about what you've experienced in terms of the preparedness of these businesses to deal with the coronavirus situation?
Yeah, certainly, Roz. I think you know, we have two very different businesses. One is the teleradiology, where we report scans primarily from US hospitals. And that we've been doing for 18 years. And it's tele. So it's all over the internet, and our doctors, our radiologists are all over the world. So it's very global. And interestingly, when the pandemic hit, one of our clients told us, he said, it looks like you've been preparing for this pandemic, you know, all along, because we are already kind of using technology for healthcare. Having said that, you know, we had to make a lot of changes in the way we worked. For instance, even though our doctors were sitting everywhere, our operations team was in one place. You know, we have a headquarters here in Bangalore in India, and our Prime Minister announced a lockdown with 4 hours notice. So the whole operations team literally had to be moved to work from home in 4 hours. And this was like a huge challenge, including like, you know, how do you route your phone calls to the call center operation guys when, you know, nobody has passes to come into work. So we really had to do a lot of kind of quick fixes to be able to enable remote working or work from home for everybody. I think, you know, the other thing that changed is when Corona hit, a lot of the diagnostic imaging stopped because there was a lockdown even in the US and the Northeast. So elective mammograms, elective scans weren't being done. So our volume went from, you know, down by 80%. And we, had this discussion and said, we didn't want to lay off people, we didn't want to cut salaries, but now we've got 80% of their time. So we really moved very quickly to enable more training. Now, how do you train when everyone was used to yelling across the desk with, let's look at this case together? So implementing collaborative tools like we have Microsoft Teams across the board. So a lot of changes. I think in our clinics, it was much more dramatic. We run a chain of 25 clinics. And there it's very brick and mortar. The doctors come in and see their patient. And the Prime Minister, thankfully on March 25th, 2020, when Corona hit, they legalized telemedicine in India. So there was, a scramble, one, to get all the doctors on the platform, train them on how to do teleconsultations, so a lot of changes in that sense in how we work just as physicians.
Certainly, of course, we've all been very impacted by working from home, also having clients and customers running basically to online platforms. I mean, this is something that ANZ also experienced. I believe CEO Shane Elliott had said that about 25% of retail customers interacted with ANZ through a digital channel in the last few months under the cover of coronavirus, when previously it had been only about 5% before the coronavirus. And so this indicates, that everyone is experiencing these changes, both on the worker side and from the customer side as well. Emma, I just want to ask you, ANZ data has also been used to help guide government decisions during this time and also make strategic business decisions as well for your corporate and institutional customers. Can you tell us a little bit more about that?
Yeah, thank you for the question. And look, I think we've actually been preparing for this under a different guise for quite a long time. So open banking is coming to Australia. It's actually already kicked off. And when I joined the bank probably 3.5 years ago, we realized that open banking was going to herald a lot more competition, which meant that the bank needed to be in a much better position to understand its own customers, clean up its data, make sure that we could use the data for customer benefit, both retail customers as well as our institutional customers. So we've been on the journey for a long time, and it's been a source of differentiation for us. When COVID hit, I guess there's a couple of things. So firstly, one of the things with our retail customers is, like all of us, people are confused. People are in all kinds of different personal situations. Somebody might work for an airline, and certainly, many airlines around the world have been impacted. We can see in our customers' data, we can see some of their own personal situations. And what that allows us to do is tailor our interactions with customers to figure out how they're doing, how they're faring, how they're doing with their home loan, for example, and whether they're going to have a hard time, and what kind of treatment they might need. So it really allows us to have much more personal discussions. I think secondly, if you think about the government packages that have been announced, we can work really closely with the government to say, well, this is how this virus and the environment is impacting our customers. And so we can give them some advice on, if you want to do these types of packages for this period of time, this will be where the benefit is most likely. So that's at a kind of a generic level. And what we've also been able to do is share de-aggregated data, which is all very safe, and it's very kind of customer private. It's not private customer data, it's de-aggregated. What we're also able to do is help them with different decisions, and it can be as mundane as people are in different places now. So how do we think about garbage pickup? How do we think about dedicated services in the community and how those need to work? How do we think about traffic on the roads? How do we think about our rail services? All of those decisions, because everything's been in flux. And so we've been able to help them, not just on packages for households and for businesses, but also in how they operate as governments. And I think on the institutional clients, we've really been able to do some of the same things. So we've got a very dedicated capability, which is helping our institutional clients with some of their decisions, which are really not that dissimilar. But it's like, wait, who do we sell to? What do we sell? How are these different markets going? How are households faring? And how are businesses like us faring in this? And therefore, what are some of the decisions we need to make differently? So it's been, we've been frankly preparing for this for a while. It is a differentiated capability. And I actually feel like one of the things that's interesting about our bank is the employee NPS, so the kind of the net promoter score from our employees is off the charts right now. And that's because actually people are already feeling their purpose, which is actually to get out there and help people.
There's always a bit of adjustment to be made, when there's such a huge surge to a different working style, a different working platform going digital, for example. I mean, I understand that ANZ had to adapt early on, I think in March, when there was a surge in traffic and one of the platforms crashed. And that's one of the areas where I think it's also a learning process as well for the company as being as ready as possible for it. I just want to ask Jamie. Jamie, you've been covering cybersecurity, you've been covering preparedness for companies for a while. What is your reporting telling you about how ready companies were for this situation?
Well, good morning, everyone. It's really great to be here, and it's really interesting listening to people like Sunita talking about the sort of the quick fixes and the suddenness with which people have had to really kind of think on the spot and just with hours to spare before really kind of just reconstructing businesses on the fly from home, where an infrastructure is not in place, where there are not protected networks, where the systems and the workflows just don't exist and have to kind of be made up as you go along. One of the things that we've been reporting from the outset is that when it comes to cybersecurity, the coronavirus has basically been bang. I mean, it's just, we are in the heyday of cybersecurity attacks on infrastructure, on institutions, on organizations, and we see it every day, whether it's nation state actors or it is criminals who have noticed a window of opportunity and are really targeting everyone from people who are working from home, who have vulnerable networks, who, I hate to say this, but it's really unfortunate. A lot of people just haven't done really simple security things like update their router password. So you're seeing a lot of vulnerabilities for people who might be working from home, who might be working with really sensitive information, not having the protection of the system that they worked in when they were working in their office, which has their own private network and an IT department, and everyone who is working focused on ensuring that the material that people are dealing with is safe and secure. We've seen all kinds of statistics about the spike in cyber attacks, phishing emails, malware, and ransomware, particularly, Sunita, I'm sure you've seen this, healthcare organizations have been inundated by all manner of attacks. And what we've also noticed, and what a lot of cybersecurity firms have seen, is that the attacks track the trend of where the virus has hit. And so when you see a spike in Italy, for example, there was also a spike in COVID-themed targeting, malware, and cyber campaigns. So the thing that has been kind of the most telling is to see where people stand now. It's been several months, and one of the things that we're talking about today, Roz, is the idea that people really shouldn't be any more sort of working at the moment and looking for things to just sort of stabilize, but to actually calibrate for this being the situation for an untold number of weeks, months, the expectation that nothing is going to change anytime soon. So you really have to fortify your security network now, and sort of the expectation of what level of trust you're going to have from the people who provide that security to you are some of the really big questions that we're looking at right now.
So talking of trust, which you just mentioned, I just want to bring us back to that poll that we did just now. I just want to ask you, actually, Jamie, would you would you sign up to a contact tracing app?
I think I would be B, which is I would if my privacy concerns were addressed.
And that is actually in line with the majority. So we saw from our poll results that 56% voted for B, which is that if your privacy concerns are addressed. 35% though still said they would do it regardless because they want to help out. And interestingly, only 9% said no under any circumstance, which is actually pretty informative, I think, about the attitudes of people, even when they are considering the cybersecurity risk, that privacy issues as well that come around the any contact tracing apps. that there may be. I mean, I know that in Australia they have been trying to use one, but perhaps not with as much success as the government would like. I want to talk a little bit about the business case for data. So, for example, there are places, for example, Australia, which have just gone to open banking, which has been a drive that's been happening for a while. And, whether it's the banking industry or whether it's the medical industry, how can you make data work for you? How can you derive extra value from that data? And, what is involved in doing that? So, for example, I'd like to ask Emma, you're seeing the elevation of data. You're seeing people realize how important it is now with the arrival of open banking. That's going to aid customers, but it also, of course, aids the institutions that are helping to push that forward, which at the moment is the financial industry.
Absolutely. And look, cultural change is really hard. We all know that. People don't like to change what they've been doing unless they feel like there's either a really compelling reason on the positive or equally on the negative. And, open banking actually provided us with a little bit of both, which is, gosh, if this works really well and we take advantage of this, look at all the great things we can do. And if we don't, we can get, our business, we can really be vulnerable to attacks from other banks or from fintechs who can just provide better propositions to customers. So I have used that kind of combination of, good and bad carrot for a long time. COVID's a pretty big bad carrot, and actually before COVID in Australia we had the bushfire season. That was a really critical time for us in terms of helping customers. So I think what all of these events tend to do is it really crystallizes people in terms of we've got to be in an environment where we can make decisions really, really fast. And to make decisions really fast, not only does our data need to be clean, but I need to be able to pull data from here and mingle it in a way that I'm not really used to doing in the past. And that means that it's not just clear in my patch, but your data is clean and your data is clean as well. And so then I can share it in a way, even within a company, in a manner that's safe and where we can kind of trace back to where all the calculations were made, such that if we had to explain it to somebody, we could. So I think if there was any doubts on our team on the criticality of data to be able to make decisions, those have all gone away. And so I think where we're now at is actually the point where data is very firmly at the top table. People understand the value of real-time decisioning for customers, for institutions. And now it's about how do we make sure that ongoing the right investments are being made. They always have to have business cases. They're always grounded in customer value. But I think increasingly you find that, those who probably in the past would have thought, oh, that's boring, that's somebody else's job. I think people now realize this is my job and I need to make sure that I'm doing this.
In terms of investment in, let's very broadly, data in general, you're talking about the integrity of the data, keeping it clean. So of course, security and making sure that that data is kept completely as clean as possible is key to that, as you mentioned, for sharing purposes as well. So in terms of investment in it, how much would you set aside to ensure the safety and the security of that data, that information, compared to, for example, percentage-wise, the investments you'd make towards driving the rest of the business?
Pretty substantial. I'm not going to give you an exact number, and I'll be very clear. We have a pot of money that we invest in actually data governance, which is it clean? Is it usable? Does it have veracity? So there's a whole big area around there. Cyber is a very different area that one of my colleagues runs, but fingers crossed, that is a consistent area of spend for banks, and it has been for a very long time. So they're a very natural kind of source of attack. So that's not really new news to us. I think the next stage of it is really what you do with that data, and so how you kind of rethink processes and outcomes that are linked to kind of customer and banker benefits. So that's kind of where we're at right now. So the investments are pretty substantial, but frankly, if we were kind of a digital native company, we'd probably be able to do much more out of the box, because technology's kind of come a long way from when these kind of crusty old banks started. So some of it's linked to how old you are, some of it's linked to what investments were made in the past. But we've been on this journey for 5 or 6 years in earnest, and so it's been pretty substantial.
Well, Sunita, your industry has been going, or your business has been going for 18 years now. So you've seen, the teleradiology business really grow. In terms of cybersecurity, in terms of, securing that data that you are sharing, because most of it is pretty personal, right? It's people's personal records. What steps have you taken, and what steps have you seen the institutions that you're working with, hospitals and governments, how do they have they increased their protection of the data, which is, of course, got increasing value now?
No, I think that's, that's something that we kind of work with every day. I think we've been fortunate that we've been working with the US for 18 years. And the United States in 1996, I think it was, instituted HIPAA, which is a security guideline for healthcare organizations. Now, the EU actually instituted their GDPR only 20 years later, but it was much, much more stringent. Having said that, since HIPAA has been there for the past 25 years, really, organizations like ours are used to working with certain guidelines. I think where it's kind of gone a little out of the window is with this whole, this whole work from home suddenly, because HIPAA needed, for instance, you have your badge. Only certain people can come into the workplace. Only certain people can access those computers. Now, when you're suddenly working from home, what happens if a spouse comes in? So we've had to do a lot of training and retraining for everyone on following HIPAA guidelines, even if you're remote. And of course, a lot of the systems, the technology we use, for instance, it's 128-bit encrypted. So by the patient name, it's all encrypted, then it comes to us, then we decode it, then we report it and send the report back. So there's a lot of kind of tech that's gone into it. And I think now with a lot of hospitals, a lot of people kind of scrambling to want to do, tele. We're actually seeing that as an opportunity because it's a space we understand, and we've kind of now been getting so many leads saying, how do we set up teleradiology? And we're saying, well, 1, 2, 3. And the first one of it is you've got to ensure, patient security and privacy, make sure you've got tech that's HIPAA compliant. I think thankfully, because the medical industry has been on this journey the last 15 years, Corona's really just sort of accelerated it, I would say. In the clinics, it's very different. Like, our doctors were not used to doing teleconsultations. And today, at least the teleconsults we do, which are in Asia, you can even do a teleconsult on a WhatsApp. So it's a WhatsApp consult. And then, what happens if you lose your iPhone? And all that conversation with that patient was on there. So I think in actual clinical, when it's doctor-patient relationships, that's where it's going to be a little trickier because docs are using their laptops or their phones, or, it's kind of all over the place, the consultations. And I think that's going to take a little bit of thinking through post-corona of how we do it, that we ensure all patient data is very, very secure.
Jamie, I think this is a burning question for you as well, because this is obviously one of your key areas of focus, the changing way that people do business and securing the personal information, government information. What do you think are the failures from your reporting that you see that could be filled going into the future, seeing as this is going to be the future?
Well, I mean, you just basically have to have, I think one of the questions that I would like to see a lot more of is a bit more transparency and a bit more openness between sort of the corporations, the governments, institutions, and the consumers. I think we talked, the example of the contact tracing app really surprised me that there was such a massive buy-in, because primarily in a lot of the countries around the world where there are contact tracing apps, there hasn't been as much buy-in as people would like, specifically because of privacy concerns. People are very worried about the data that that governments have, that corporations have, that businesses have. And, one of the questions that I'd sort of love to have Emma sort of speak to a little bit is the I guess it was the application or the submission to parliamentary inquiry by the banks to ask for a centralized cybersecurity center that would look at data breaches by third parties into the banking system. And I think that that's really interesting. I think that, we can do everything we can on our end. And then, then you have instances like the Twitter hack last week, which showed that you can do everything as a consumer. You can have two-factor authentication. You can have a VPN. You can do everything you want, but you cannot account for what might happen on the other side with your data. And I think that is one of the big questions that a lot of people have. And as you said, this is the new normal. We are going to be seeing more and more of our lives online. More people will be applying for loans online. More people will be entrusting their medical records online. There'll be conversations happening online. And, the algorithms that allow, banks or organizations to look at a consumer's data, a customer's data, and try to tailor solutions to them is something that I think that we'd like to see some transparency on, and sort of an explanation of how that data is used. Arthur was great about talking about the fact that a lot of the data that Hong Kong has with its wristband contact app is anonymized. And so I think that when we look at examples like that, most people acknowledge that we have to sort of surrender many rights when we agree to have many things online. There was a survey that, the number of people who actually read the terms and conditions was less than 10%. So at the same time, there is an expectation that when you do sort of hand over much of the life that you have online to corporations and to institutions and to the government particularly, that there's a social contract there, and that privacy won't be compromised. So it's a double-edged sword really, because we do need to see some buy-in, but we'd also like to see some transparency.
I'm afraid I'm going to have to close the conversation now. I actually have a whole ton of other questions to consider for our discussion, but we're running out of time. So I just really want to thank all of you, Jamie, Sunita, and also Emma, for joining us and for your time today. We hope the discussions that you've been listening to provided some food for thought for all of you. And while you're just digesting it, we'd also welcome your feedback. A survey is going to be appearing on your screen, and it'll just take a few clicks to complete. If you have any more questions, if there's any more of this conversation you'd like to continue, just please get in touch with our team. And thank you, of course, to our speakers once again for joining us today. And of course, many thanks to ANZ, our sponsor, for helping us get this all on the road. Follow us on Twitter by finding @Bloomberg Live and on LinkedIn for updates. And also be sure to check for our ongoing financial and markets coverage at Bloomberg and on Bloomberg.com. And if you haven't already, please consider subscribing on Bloomberg.com/subscription. So once again, thank you to Emma Gray from ANZ, Jamie Tarabay from Bloomberg, and also to Sunita Maheshwari from Teleradiology Solutions for joining us today.
Thank you.
Thank you.
Thank you. Thank you.